asked all of our activities what their plans were in terms of returning to face-to-face delivery on site. And of the 35 activities, at least 25, around 25 of them said, yeah, these are the plans and we want to come back by October. Now, even before London moved into tier 2, we hadn't got anywhere near that level of 25. And some of that is one of the issues that we didn't foresee is actually where it comes to discretionary services, actually a reluctance of the members of the community to actually come out and engage, partly because of all the uncertainties as what's happening with the COVID environment generally, and also in part because of the misinformation that's out there, and that misinformation or the issue of misinformation is sometimes exacerbated in our locality because of some of the issues around language and also issues around digital inclusion, which is again something, if there was something else we didn't kind of foresee necessarily, was actually just how important face-to-face delivery is and human contact is when there are so many people who are digitally excluded, and that actually points to some of the service changes we need to make in the future. But that's kind of beyond the brief of this webinar. But of the activities that came back, we had I think 12 activities that come back. Some of them were walking groups, which Khadija is going to talk to us about later. We started to do some ESOL registration, some family activities, some horticulture activities. So some of those activities were started to come back. But as I mentioned just now, one of the things we didn't foresee is that where we're offering activities and hoping that people would come, and ordinarily the communication channels we would have used pre-lockdown would have been enough to attract people and individuals to some of the services we're offering. But those means of communication just either weren't getting through, or they're getting through, and because of the reluctance of people to actually come and engage at the centre has meant that some of what we've been offering, actually there's been quite low turnout for them, which is interesting because it's, for some of the services, the demand has increased exponentially during the course of lockdown, because of the growth of demand for the food bank services. The food bank came onto the centre's site, and during the course of the last 6 months, the number of users of the food bank has gone up from around 100 per week to over 500 per week. So there is a huge demand for increased services in certain areas, as I'm sure many of you are finding as well. But where those services are non-discretionary, they're being taken up. I think where they're more discretionary, as I say, there's a reluctance to kind of engage. I think something else that we didn't foresee was just how difficult it was to reach people without having that face-to-face contact. And one of the things we're doing very differently at the moment is thinking again about our outreach services, and thinking about how do we reach members of the community who are maybe staying indoors even more than they were before. How do we reach people who are socially isolated? And when we're doing the outreach, how can we do it on the basis of actually reducing exclusion and getting people just out of the door, rather than necessarily being focused on specific services or specific reasons or activities where people might want to come to the centre. And I think if I look back to what we've done over the last 6 months and what we might have done differently, actually one of the things we didn't do was just continue with those kind of face-to-face contacts, which are obviously difficult to do when you're socially isolating, but how do you have cups of tea? And we're not talking about cups of tea via Zoom or Teams or what have you, but how do you actually have a cup of tea with somebody and get them out and engage? And I think some of the more informal sessions that we used to run and we just take for granted, they've kind of fallen off. So I think as we re-emerge from tier 2 lockdown, I think that's an area, that will be an area I think we want to pick up in a more structured way, without losing that casualness of just bumping into somebody just because you happen to be in the same physical space at the same time. And then the third area, just to mention very briefly, and sorry this is so brief, but I'm trying to stick to my 5 minutes, is what does all this mean for the future? And one of the things that, again, I'm sure as with the organisations and with a lot of organisations, we will fundamentally rethink our use of space and how we attract people into the space for those informal kind of casual catch-ups and opportunities to just meet up with friends or make new friends, but also recognising from a space dynamic for the centre, we will no longer need, we have around 100 employees, we will no longer need 100 desks for our 100 employees. So that gives us an opportunity to really rethink the space. It's also interesting, given our partnership with the health practice, they're also starting to think about, well, how do their space requirements change with so many consultations now being done virtually? The need for a GP's practice or the footprint for a GP's practice in 2030 is probably going to look very, very different than it did at the beginning of 2020. So that's been I think will be very interesting for us over the coming years. I mean, this isn't going to be a quick thing, but in terms of what we've learned from COVID and taking those opportunities, one of those things is around how do we use the space and how do we improve the use of the space to make it much more of a community feel. So that's all I think I've got time to say, but obviously if there's any questions coming out of this, we've got lots of time towards the end of the session, so I very much look forward to answering your questions when we get to that stage of the webinar. Thank you very much, and back to you, Bernice.
Thank you very much, Michael. Actually, maybe we have time for a quick question now. Someone sent, I think they sent it just to me, but that's fine. Hi, Michael. Has the centre seen a new kind of loneliness, isolation emerging? I recently heard about people living with family but feeling isolated. Do you know anything about that, Michael?
To be fair, I'm probably the wrong person to ask about that. I think it's a really relevant point, though. You know, how do we use the space within which we're in, or where we're in? Maybe that might be a good question actually to ask Khadija.
Yeah, definitely. Let's go back to that after her presentation then.
Yeah. Great.
Okay. So right now, what I'm going to do is show you this little presentation. Show everyone this little presentation from Soul Marmot. I will now share the right screen. Just give me 1 second. All right, so and let me just all right, so here we go. And I hope everyone can hear. If you can't hear properly, just send something in the chat and I'll see what I can do.
Hello, my name's Saul Marmot. I'm one of the GP partners from Bespoke Health. It's funny how time changes perspectives. A couple of years ago, we were all running around feeling in crisis. We knew that the NHS and the voluntary sectors were really suffering, not to mention climate emergencies, political and economic chaos around the world, and the general disintegration of society. Sound familiar? What that did at the time, though, oddly enough, is it did prepare us a little bit. We knew that we had to make major changes to the way we did things before the next crisis hit. Little did we know quite how big, bad, and right on top of us that next crisis was. So while we were engaged in quality improvements and change ideas and patting ourselves on the back at our rapid pace of change, little did we know quite what the word rapid would eventually come to mean. It's funny how absolute necessity changes the mind. So when the sticky mess of Corona hit the fan, we had three priorities at the practice. One was to protect our patients, one was to protect our staff, and one was to protect our organisation. So we had not enough physical space to do this, and unfortunately, all of our clinical and non-clinical staff had to be split up and move into different buildings to work alongside colleagues elsewhere where there was safer spacing. This was obviously very, very hard, but what it did is it enabled us to bond as a team, but also to work with our colleagues who we wouldn't necessarily have worked with before very closely, in order to bond the wider team in the organisation, but also to learn from each other. We had to undertake risk assessments for everyone in the organisation. We had the daily battle with PPE, trying to secure enough masks to see people. We instigated a program where the staff who weren't 100% necessary to be in at work were having on-call days, which meant that they could be at home, they could feel safe, but that they would be called in if they were needed. We even changed our cleaning regimes and our spacing regimes. So we had to measure every single room to see how many people were allowed in at one time. There were X's marked on the floor to say, you sit over there, you sit over there. And our general cleaning routines even changed the way we had to go to the toilet. We realized, of course, that our staff were vulnerable, but of course the patients were even more vulnerable. Coming from groups of high deprivation who had very serious long-term conditions, unfortunately, at a time of crisis like this, the vulnerable become even more vulnerable. We decided the only way really that we could cope with this that was safe for our patients was to talk to them more. So we set up to change the way that we did all of our consultations. So unfortunately, like so many other GP surgeries, we had a system before where we tried to accommodate as many of our patients as possible, and they had to queue up either on the phone or in person at 8 o'clock every morning and take their turn. And eventually they would be told, I'm so sorry, we're full up, could you phone back again the next day? We realized that this was not viable for the patients during the time of coronavirus. So we had to change the way we did things. So we instigated a way of setting up e-consultations where they would write to us all of their ideas and expectations and symptoms and submit them electronically. This gave us a chance to read up a little bit about what they needed, to read up about their past medical history, and even to take a sneaky peek at the textbooks to make sure that we were getting things right. We set up telephone consultations, video consultations, text message advice, photos back and forth. And it is important to say that those people who really needed to see us face to face were still being encouraged to do so. How would we support the staff? So at the time, one of the things that was most popular was our huddles every morning. So the staff would get together and have conversations either about the latest guidelines, and believe me, there were a lot of guidelines coming through, or people's fears, or what people found to be the biggest changes. We even talked about how people were affected by Black Lives Matter or the climate change. People would come in and tell jokes or tell little stories. We had a lot more team meetings via Zoom. And of course, there was lots of cake. We felt at the time we were adapting to the future. Unfortunately, we thought the future would only last for about 3 months. It took us a while to realize that the future is forever. So now we need to look to the future. And how do we do that? So we want to, what we did is got all the staff together, all the partners together, and all the patients to come up with ideas. What do we want to keep from our new systems? And what do we want to get rid of? What did we miss from our old systems? How could we take together all of this learning and build back a better future? So I suppose a few of the things that have really stuck. Firstly, access for patients. Now that we've moved back to the Bromley by Bow site, we still want to speak to all of our patients on the day that they make contact with the surgery in order to really find out what's happening and in order to stop small problems developing into big ones. We're still employing the e-consultations, the telephone consultations, and seeing patients face to face. And we're getting feedback from the patients to find out whether this is working for them. We're still maintaining staff cohesion and involvement so that staff are involved in all the decisions made, particularly around safety. So one nice example is the staff all wanted clear perspex barriers at the front of receptions, which we wondered whether that would impede connection between them and the patients. However, that's what they wanted, and so that's what they got. We want the patients to become more involved too. So we're setting up groups for the patients to actually become formally involved in the governance structures of the organisation. Together we want to build a resilient, flexible organisation because, frankly, who knows what's around the next corner and what the future's going to bring. So, it's been a pleasure speaking with you, and hopefully we'll see you again soon. Bye.
All right, so that was Saul Marmot, one of the GP partners, at Bespoke Health. So what I'm going to do now, if I can find again, I'll go back to the slides. So if anyone has any questions, I can you can always ask them here again. And obviously, he's not here with us today, but that's something we can kind of share in the feedback as well, in the follow-up email. Any questions you have, I'm happy to kind of send that to him, and he can answer in written if that's if there's anything you want to know. So right now we'll go on to Khadija. So Khadija, I think I need to. Oh, you can unmute yourself.
Yeah.
Hi Khadija, how are you?
Hi, Bernice. I'm good, thank you. Hi, everyone.
Thank
Okay. Hi. Yeah, do you want me to go ahead, Bernice?
Yeah, go for it.
Yeah. Okay. So in the planning of reopening some of our services, Michael mentioned earlier when we were asked what services we wanted to and what activities we wanted to bring back to the centre. My area of work has always been with the community, and very recently I started working with the older population, so 50 plus. But I've continued to do work, so intergeneration work. And so one of the things we had started to look at is doing risk assessment of the space that we would be using. So we were all asked to complete a risk assessment, but what we found is also actually being in the physical space and testing it out ourselves, how that would work. So we did that on a couple of occasions, looked at sort of routes and how we would risk assess our sort of routes when we started the working group. And once we did that, we spoke to some of our clients who are interested in, there was an appetite, I think, from the residents that, they wanted to come back to some kind of activity. The online activities were quite a bit of a struggle for getting some of our residents online. I think we found, again, like the digital poverty, there were a lot of people who didn't have a smartphone, who didn't have the IT equipment to get online. And it had been quite a frustrating few months. We did one-to-one calls, trying to get them on Zoom, using WhatsApp. Anyway, like everybody else, it's been a bit of a struggle trying to get people online. And I think people are missing the human interaction, seeing another person face to face. So we started doing individual risk assessment, similar to what Saul had mentioned earlier. So we also did those with our clients. So over the phone, we would do an assessment with each individual client, and also talking about their, if they had any concerns, any anxieties they wanted to address with us, because it has been quite a unprecedented experience for everyone with this COVID situation. And I think the building that trust was so important again. And people wanted to make sure that we were COVID safe. So the centre, the measures that we had put in place were safe enough for them to come out and enjoy some of the activities that they were requesting. And once our risk assessment with individual clients had been completed, we sort of asked them really what they wanted. And one of the things was the walking group. We looked at that, and I think because it's in an outdoor space and it wouldn't be meeting inside, and the rules kept changing so many times over the weeks when we were planning the different activities. And people felt comfortable meeting outside. So we went with the walking group to start off with. We had anticipated the coffee afternoon, which we're still thinking of reopening again. That would be indoors. But I think it's just really having those individual conversations and talking to people about, how they felt about coming along, and also looking at their wider sort of family, if they were, living with somebody who had long-term health conditions, and just really the individual circumstances. There was quite a lot of anxiety at first. I think people they wanted to have physical activities, but also about the if they could protect their families and other loved ones. So we had quite long, extensive conversations around that, and I shared the risk assessment with people who asked, but I just sort of said, these are some of the things we've put on. And some of our other projects are doing so cycling groups, which are also outdoors. And I think being outdoors is a good way of restarting some of those activities, and then hopefully moving indoors as the weather starts to change. So yeah, and I think just regularly having those conversations about the government guidelines which are changing, and also what are the social distancing measures, because we were once told it was 2 meters, then it was 1, and I think now we're going back to 2. So just regularly having those conversations, I think they really helped people to just to address it with others, because a lot of our clients we're finding are sort of living on their own, or are with other family members who are not around. Maybe, you know, they're living with their children who are out at work most of the time, so they feel quite isolated being indoors. Previous to where the centre was open and we had so many different face-to-face activities taking place, you know, if they didn't enjoy one thing or they felt like they wanted to try something different, the opportunity was there. So we're still having ongoing conversations about what other things we could start offering to some of our clients. And I think for some of the work that we had done with residents where we had built that confidence, a lot of people are lacking in confidence just about leaving their house, really, and the whole anxiety of, you know, they don't want to put themselves or anyone at risk. So those are some of the conversations we've been having, and I think we're quite confident now to start rethinking about we can have indoor activities and the coffee afternoon. I'm hoping to restart that very soon. I mean, before we would have up to 10 to 15 people who would attend, but I think now our numbers would be up to 6. And again, for those activities, it's about, you know, how we have to do things like, you know, measuring people's temperatures, having cleaning sort of stations on site, and just really having those regular conversations to manage people's anxieties. So the walking group's been happening for 4 weeks now, and it's actually been really helpful for some of the residents who have felt quite isolated being indoors. You know, we have people who are carers for family members who really don't get a break, where, you know, the people they're caring for are not actually going out to day centres or are not having those breaks that they would normally have. So I think it's like they're once a week, something to look forward to. And it's been very positive, very well taken. I mean, we had a walk this morning, and you can see for yourself some of the things people have been saying. But I think it was really touching what somebody said today. It gives them a purpose to wake up in the morning, to look forward to something. Otherwise, they say, you know, she was saying that a lot of the time she tends to stay in bed till quite late. There's nothing to look forward to, she was saying, you know, and this is something that's giving her a boost to sort of get out, get changed, put a bit of makeup on, and look good for herself. So that's been taken really well. And I think, you know, we're having lots of conversations with different clients. I think I can see from a lot of the conversations I'm having is there's a bit of anxiety. And again, now the rules have changed. The similar questions are coming back up again. You know, is it okay for me to leave my house? Am I going to be safe? And I think the group are very good in looking after each other. They will keep that distance between them. They will tell each other about their experiences. But I think, you know, if there are things, they will also advise each other. Oh, don't do this, or you can't do that, or we can't do such and such. So that's really nice. It's like a really lovely little group that's developing over the weeks. And I think, you know, there's been an impact, as we will know from all our clients, that on people's mental health, and not being able to see other people face to face. And on the first week, there were lots of happy smiles, just really, you know, the happiness in people's faces was amazing. The only thing was they couldn't hug each other, but yeah, they also remind each other, oh, we can't hug, but, you know, we do virtual hugs on our online coffee sessions as well. So in terms of how we want to progress going forward, I think we will keep some of our online activities. I think there is a need to have online activities, but again, you know, those people who can't attend online, we'll try and offer them, even if it is walking twice a week. It gives people a sense of having something to do, seeing other people face to face, and also just trying to manage people's mental health. There is there is a need, I think, to have those online sessions so that there are, we have clients who are not able to leave their house and previously due to long-term health conditions. And I think before there wasn't a need to deliver online sessions, which maybe COVID has pushed us to do that a bit more, maybe look into that more. And it's again a regular check-in for people to have conversations with other people online. And it's also been a central check-in point during lockdown as well, where people have been able to see other familiar faces online. So we will continue to have online activities as well as face-to-face activities. Yeah, I think that's it from me. Thank you.
Thank you very much, Khadija. There's let's talk about those questions we have in the chat. So someone is asking, what measures will you take to carry indoor delivery, please? So do you have anything specific about that?
Yeah, so for the indoor activity, what we've risk assessed the space that we're going to use, and I think the space will only allow us to have up to 6 people. So the measures we have is we'll separate tables where maybe 1 or 2 people will sit. But before all of that, we've so thought about where so we would clean down each space. And I think as we go along, I think each space will be cleaned before and after the sessions. We've decided not to share any equipment at this stage. And what we will do is provide people with sort of individual, they will have their own sort of pack where they will have an activity that they bring with them, and then they take with the pack with them. So then, there's no cross-contamination. We don't have to think about where to store those items as well. We'll be taking people's temperatures as they come in. So there'll be a staff member who will take temperatures. And we have these conversations before the actual session. So there'll be a phone conversation with each individual who attends the session. We will explain to them, these will be the procedure, just so that on the day, if somebody's temperature isn't the temperature that we can allow them in, that they know that, okay, this is what they can expect. And I think we have hand sanitizers before they come in, and we would encourage people to sort of use the hand sanitizers. We've looked at things like the toilet facilities, and also we would provide, and again, outside the toilet, there is hand sanitizers, so people will be encouraged to use that before and after. And we've also thought about providing sort of, wipes inside if people want to start cleaning after themselves, but there'll also be cleaners on site who will clean regularly. So those are some of the measures we've thought about.
Thank you. That's really helpful, Khadija. And would you mind talking to us a little bit about the sense of loneliness and isolation that we mentioned earlier?
Mm-hmm.
Like how have you seen it evolve with the people you interact with, even people who live with their family but still feel isolated?
Yeah, I think loneliness and isolation has been one of the biggest sort of key areas we've been trying to address for a long time. And people, we've heard people are living with sort of family members, but still it might not be, they might not be engaging in things what family are doing. So it's a really tough one trying to address. And I think we're having those one-to-one conversations just to see what would help some of those people. Even if it means, once a week they get an opportunity to come outside, and even if it is just for the walking group. With the coffee afternoon, the numbers are limited, and we have to sort of create bubbles each week and then sort of recreate that bubble again every week. But I think just encouraging people to take short walks if they can themselves, take a family member with them. And I think from the walks, what people are sort of saying is it's always nicer to meet somebody else outside of your household, or have a purpose to be able to go out and do something with someone else. And I think previously clients have said, they feel a sense of belonging when they've been able to offer something back to the community or be part of something. And at the moment with COVID, it has been quite difficult trying to, get people to be part of something. And I think the online sessions that we have, we really I mean, we've all struggled getting online, so we can expect some of our clients who are not that confident. So it's about, maybe before the session, just ringing them up and saying, are you okay? Maybe leave your camera off for now, and slowly saying to them, you can turn your camera off as camera on as time goes on. So just really like looking at individual, what their needs are and how best we can support them. But people are still reporting that they are feeling quite isolated. Some people live in big households, they don't have space for personal space. So having a phone conversation is quite difficult at times. Not having a space where they can go and, listen to what I'm saying or someone else is saying. So yeah, I think it's, one of the tough ones that we are trying to address.
There's an excellent question about, so how are you advertising to the community, the different sessions that are active and running? And also, are you taking new referrals?
Yes, we are taking new referrals, and a lot of our referrals at the moment are coming through our social prescribing team, and also other projects in the organization, and word of mouth. So, we are trying to spread the word, and just people who attend on the walk, I've asked them to tell their friends about it if they are interested, and hopefully, the numbers will increase. And in terms of advertising, we advertise on our newsletter, but also we have a service delivery newsletter that gets sent out on a quarterly basis to all our clients who have signed up to our newsletters. So they get that once a quarter. We try advertising through other projects, asking the health partnership also to advertise it to their patients as well.
Great, thank you very much, Khadija. Michael, would you like to come and maybe on camera and because I saw your comment, if someone is not reading the chat, to kind of add to Khadija's point on the measures that are taken for group activities.
Yeah, of course. I was listening very closely to what Khadija was saying. She covered absolutely everything for individual activities. The only thing I'd just put in the chat is that we are tailoring the measures we put in place to the specific activity because they will be different. Clearly, an outdoor walking group, the risk assessment for that is very different from an indoor social care group. So, it's not a one-size-fits-all approach. And the other thing that we've learned is that, as with any strategy is great until you hit the enemy, and it's true with our services that once the reality is, when we see the way people move and interact and actually behave, if that's different from how we imagined when we were putting together the plans, and obviously we'll change the approach that we take to fit reality as opposed to what was imagined. So it's just being flexible, really.
Yeah, there's an assessment for every single activity to make sure it's.
Yes, yeah. And if I could just, I think the thing that was key for, and Khadija did mention this, so forgive me for mentioning it again, is actually letting people know in advance what's expected of them when they come to the centre. So if they're expected to bring a mask, they're not surprised when they get to the centre if they're asked, where is your mask? So yes, because there are needs on both sides, and again, as Saul has said, yes, it's about protecting the clients, but it's also about protecting our employees as well.
Absolutely. And does that have an impact on how to prepare activities and things like that? Because obviously that's a extra layer of preparation for programs and service delivery. Yes,
it is, but it's also while it is another thing to be thinking about, it's also then thinking about, well, how will the client react, or when they come to the service, and therefore what does that need, what impact does that have on how we reduce the risks when we're actually running the service? So it's actually very helpful as well in putting the project managers in the shoes of the clients, to think about what their reactions will be.
Absolutely. Yeah. Thank you very much, Michael. All right, so now we'll move on to Dan's presentation. So Dan, I can't see, but
yeah, I'm here. Yeah.
Awesome, great.
Thank you.
I'll leave it to you now.
Thank you, Berenice. I'm going to be brief so that we've got some time for more questions and maybe discussion. But I think thinking about the longer term, it probably has to be said actually that much of this crisis situation, we feel, really affirms the Bromley by Bow Centre's model, which we've developed over the last 35 years. And that we brought primary care into us, this integrated health and community model, about 22 years ago. And we've been working with a whole range of organisations, including the Greater London Authority, people like the Arts Council as well, the Advice Services Alliance, and Advice UK and others, to sort of really start to think about what the future looks like and what the support is going to be needed over the next few years, really, and what the ambitions are. But it is very much around kind of a new localism, I think, and how one creates, strong communities within neighbourhoods, and how one gets as much, service provision and support that one can really close to where people live, which has been very much always part of the Bromley by Bow model. And I think one of the important things for us has been the linkage between that and primary care. And social prescribing really, developed at Bromley by Bow over 20 years ago now. But under our plans, in part shaped by the COVID experience, really, we are significantly expanding social prescribing, the idea of using the data that exists within primary care to understand people's vulnerabilities and the benefits that social prescribing might give to very large numbers of members of our community, really. And we've expanded our social prescribing link worker team now to 7.5 link workers across our primary care network. And that is really, really important. Another example, I think, is we know that we're going to be facing increasing levels of unemployment and hardship certainly in the next year or two. And one of our responses to deprivation and the needs of our community around good employment and creating opportunities for young people and so on has been to support people to develop social enterprises. Over the last decade, we've supported over 80 people and groups within our communities set up social businesses that have created about 400 new jobs in our community and also helped to provide services to our community. And we've just now launched a new round of funding for social entrepreneurs in our community to establish social businesses. And we've been busy giving those social businesses a lot of support over the last 6 months because we know that the trading conditions are difficult. But this is, the Bromley by Bow model is a lot about communities sort of supporting themselves and developing their own solutions. And as Michael mentioned, the food bank, which was running in a local church but didn't really have the conditions for such vast numbers, moved into Bromley by Bow about 5 months ago. And that gives us weekly contact now with about 500 families that live locally who are accessing emergency food through the food bank. But it then allows us to connect those families to the wide range of offer of services that we have available at Bromley by Bow. So finding these contact points, such as primary care or emergency food, is a critical way of connecting with community. And as we go forwards, we see this approach, this very local approach to supporting the needs and engaging with communities and harnessing the power, the latent ideas and creativity that reside within our communities is really, if anything, all the more important as we go forwards. Thank you, Berenice.
Thank you, Dan. All right, so if anyone has any other questions, I see some people have shared what they were doing as well. Sorry, my video is off. But if anyone has any questions at this point, we can do some more questions. But otherwise, we have, I like that. So arts group, book groups, relaxation, or simple opportunities to chat. That's great. That's really interesting to know. If anyone else has any tips and things, feel free to share. What we can do now is we have, because we've done already some questions and I see there's no more questions for now. So what we can do is we'll break out into groups of 5. And we can talk about kind of what is your organization starting face-to-face delivery again. What are some challenges, or if not, what kind of alternative do you have in your own organization? So that can be a nice way of exchanging some ideas and some different ideas. We'll have 10 minutes to talk about this, maybe 5 minutes, and then we can come back all together. So I'll put you in breakout rooms right now. You should receive a notification in a minute. So yes, thank you. So what we're going to do now, sorry it was so short, a discussion. What we're going to do now is first I'm going to put a poll up on your screen just so that you can fill it in during the last few minutes of the webinar. And then if anyone wants to feedback in the chat function about their discussion just now, or if anyone, we have time for one person to feedback orally, come on video, or just unmute themselves and chat about, and maybe let us know a bit of feedback about that discussion just now. So maybe just raise your hand or just unmute yourself and come on there and let us talk. No one wants to share what the discussion was?
I'll do it briefly if you want.
Great, thanks.
We just had a very brief discussion, some around how new habits were formed. So how some people have adapted to how stations have moved, so particularly online, or created new opportunities for themselves, or picked up on new opportunities available to them. And the other one was around how some people have engaged, where people who were in physical attendance to groups and support and things have somewhat dropped off through that not happening, or not having the digital connection. But some new people have felt more comfortable around joining and using the technology rather than being in that face-to-face. So I think, as with all of this, always with conversations come the end of the webinars, it's always a bit like you need more than just one option. That enables people to engage, and striking that balance is obviously really key.
Great, thank you very much, Gareth. That's great. So I see people are starting to fill in the form as well. So thank you very much for your feedback. So just to kind of conclude, I just wanted to let you know, so we've got a lot of other webinars coming up. Some more are going to be put up on the website in the next few days. We have some Bromley Bible Centre essential sessions. So that's focusing on the Bromley Bible Centre's model, especially, and values, and how it's been created, its history and context. So we have some of the sessions every 2 months, sorry. And then we also have some social prescribing link worker training and qualifications that we run. So you can have a look on our website. I just pasted the link of our website on the chat section, so you can have a look at that. But yeah, in a few hours, you will receive a follow-up email from this session, just with the link to the recording and the slides and everything that's been mentioned today. So yeah, thank you very much for joining us. We always welcome any suggestions. So if there's any specific topic you would like to talk about in one of those sessions, please do let me know. We're really happy to have a chat about any specific topic that would be useful. So do get in touch. Do get in touch with us. That's helpful for us as well, to have your feedback and know what you would like to talk about. We also have some bespoke workshops for teams. So same again, just get in touch and we can chat about that. Our email address, I'm going to put it right now in the chat. And yes, so hopefully see you at our next webinar. And as usual, if there's anything you would like to share with us, just get in touch.